Hi guys, welcome to Podcast Man. Today the topic of discussion in this video is about general scheme of case taking when a patient comes to the surgical outpatient department. So in this video we are going to discuss everything in detail about history taking in surgical department or surgery department. First of all, coming to demography, patient details, we're going to ask for the name. So, in the vivas that you are going to do or to approach a patient, even you have to know significance of all the details regarding demography, where the name of the patient signifies for identification of the patient, and it also gives a psychological benefit to the patient that okay, doctor knows me and. He will feel more connected towards the doctor when the doctor calls the patient by his name. So that's so important of it. And from age, you can say a few things like a few anomalies or few diseases are common in certain age groups, like cystic hygroma, cleft lip, cleft palate, sarcococcygeal teratoma, phimosis. All of these diseases or disorders are seen in since birth, and few diseases like persistent urachus, branchial cyst, bronchial fistula. All of these are seen in later periods of life. And in infants, you can commonly see acute arthritis. Acute arthritis, chronic arthritis is, whereas chronic arthritis is seen in the older age groups. And the next thing is osteomyelitis and Wilms tumor of kidney. Wilms tumor of kidney is a by birth. It will occur since from the infancy itself, and in the teenagers you can see sarcomas most commonly, and in girls between 14 to 25 years we can come to see appendicitis cases more, and in old age you'll be seeing osteoarthritis, benign hypertrophy of prostate, like that is BPH, benign prostatic hyperplasia. And coming to the significance of gender, females, the gender significance of females is females are more prone to thyroid, visceroptosis, movable kidney, and cystitis. And in males, they're more prone towards carcinomas of stomach, lung, kidney, and even hemophilia, as it's a inherited disorder, hemophilia. Religion, the importance of religion comes here, and the examples of importance is carcinoma of penis is very rare in Jews and Muslims as they undergo circumcision in the early stages of life, and there is no phimosis or subprepucial infection, where it is an infection under the prepuce. There is no cases of that in Jews and Muslims as well. And month-long fasting in Muslims will prevent interception. And next, coming to the social status, in richer groups, acute appendicitis is more commonly seen, and in the poorer social economic status groups, tuberculosis is most commonly seen. Coming to the occupation, occupational disorders here are very important. Like for examples, we'll see some examples. Bus conductors will have mostly varicose veins. Varicose veins are also present in long-standing workers like traffic police, surgeons who will operate in the OT for long hours, etc. Even teachers can also have varicose veins, and unnamed eye workers will easily develop will most commonly develop urinary bladder carcinoma. Chimney sweepers can develop carcinoma of scrotum. Even tar and shale oil workers can develop this carcinoma of scrotum as well. And coming to the footballers, miners, they can injure their median semilunar cartilage in the leg, not in the leg, in the knee. Okay. Then students' elbow, it's common in students who write or read with their elbow put on the table. Housemaids' knee, where housemaids will be cleaning the house with their knees bent, kneeling on their knees. So that is common in them. And there is a tennis elbow as well. Tennis players might develop tennis elbow, which is a bursa inflammation. Coming to the residence, importance of residence. So few parts of the country will have few diseases most prevalent in their region. For example, Orissa will have a high prevalence of filariasis. Bankara district of West Bengal have high prevalence of leprosy. South India have a high prevalence of peptic ulcers. Egypt have a high prevalence of bilharziasis. In Africa, it is another country where the sleeping sickness is more common, and Australia, Greece, Turkey, Iran, Iraq, UK, all of these countries are more common in hydatid disease. Tropical countries will have amoebiasis is more common, and in Kashmir you can see Kangri cancer, where the workers in Kashmir, charcoal industry workers in Kashmir, will carry the charcoal in burning charcoal, that too in pots with the pots attached to the abdomen. While carrying, they'll attach the pots towards the abdomen. They will hug them like that, so it can lead to the formation of Kangri cancer. So coming next, the next thing is we by here we got to know about what are the importance of demography details of a patient. And now coming to the chief complaints. In chief complaints, you have to take all the chief complaints in chronological order, like in what way they occurred. Like first, this pain occurred or the swelling occurred, the ulceration happened at first, or the swelling developed at first. Different chronologies will be there for different diseases, so you have to be thorough with that. If all if all at the same time, then you should note this. If all the symptoms comes at the same time, then you have to note the chief complaints in the order of severity. Okay, then. Coming to the history of present illness, this is basically history taking that students of MBBS must know about in surgery department. I have taken all this information from ISDA's textbook, not textbook, a practical textbook of surgery, which is a standard book for it. So let's go to the next topic, which is history of present illness. In history of present illness, the most common things that you will ask in every other department as well is first the mode of onset, then the next is progression, and the next is duration, then is aggravating factors, relieving factors, and associated symptoms. Okay. In mode of onset, you have to ask if it is sudden or gradual. In progression, you have to ask about if it gradually progressed, where it means it progressed over months. If it rapidly progressed within weeks or days, even. um then coming to the aggravating factors, if that swelling or pain or ulceration has increased on doing anything, whatever the complaint the patient comes from, if that is increased on doing something, then that factor which he did, that work which he did, comes under the aggravating factor. And coming to the relieving factor, which can be like if the patient of appendicitis comes to you, they will have a relief after lying down, after resting for some time. Peptic ulcer patients will get the pain relief after eating food and before eating food as well. Because duodenal and gastric ulcers are two different things, and you can differentiate both of them by this event. So that can be the importance of this aggravating and relieving factors. Relieving factors can also be after taking NSAIDs, that is non-steroidal anti-inflammatory drugs that we use to treat pain temporarily. Then coming to the past history. So this is the thing that you are going to take in history taking, history of present illness. But associates, if there are any associated symptoms along with the thing the patient principally came here with, you have to mention their HOPI as well. What is that? History of present illness of that particular associated symptom also you have to write. For example, if the patient has a swelling, okay, you have described all the onset, progression, duration, and aggravating relieving factors of swelling, but he has an associated symptom of pain. Okay, then you have to write all about the pain, history of present illness. like when did it start, onset, progression, duration, severity, nature of pain, type of pain, if there is any radiation shifting or referring of pain. So all of this we'll discuss in the further videos, but for now you have to write all of this. You have to ask for all of this history. Each associated symptom, if it is a little specific symptom, you have to ask about it. Like if it is fever, you have to ask about fever history as well. Then if it is about vomitings, diarrhea, all of these are little significant symptoms. Okay, if there is any cases that are more relating to the headache, you have to take the history of headache as well. So every associated symptom should also have a separate history for it. Okay, then coming to the past history, now the history of present illness is over. Now coming to the past history, you'll have to ask about similar complaints in the past. All the details of it also you have to note it down. Like if there is a swelling, for example, so there is a history of swelling in the past and it has got treated in the past and got cured. So I have to ask about all the history of that as well, because in few cases there will be recurrence of diseases or recurrence of swellings, ulcers as well. So to rule out that, you have to ask about similar complaints in the past as well. And coming to the comorbidities, we have to ask about the comorbidities. What are comorbidities? Comorbidities are the chronic illnesses that are present till now along with this complaint that a patient has come with. So, for example, you can say diabetes mellitus, it is a chronic disorder which will also be present along with this disease, this complaint the patient has come with. So, comorbidities can be diabetes mellitus, blood hypertension, asthma, bleeding disorders are very important here, because if the patient is going to undergo a surgery, so then bleeding disorder, if there is a problem of bleeding in the patient there, then there can be a very severe complications during the surgery. So then, next comorbidity can be rheumatic fever, syphilis, gonorrhea, any kind of chronic diseases. You can ask if it is relatable. Like it can be tropical diseases as well, like tuberculosis, dengue, AIDS. All of this also we can use to ask from the patient. And coming to the previous illnesses, in the past history we have discussed about similar complaints in the past. Then next comorbidities, then previous illnesses. Now previous illnesses means comorbidities are the diseases that are chronic and still existing with the patient till now. And previous illnesses are if there is any relevant complaint in the past that the patient had but don't have it now, that is called previous illness. Know the difference, that previous illness is not existing now, but in comorbidity the illness that he has been chronically having is still existing now as well. So you can ask for, in previous illnesses you can ask for peptic ulcers, acute pancreatitis, tuberculosis. Tuberculosis can also be cured, right? So it can also be included under previous illnesses, gallbladder disease, appendicitis, etc. Then the next history that you have to ask about is surgical history. If there are any previous surgeries that a patient has undergone, and there is any trauma, history of trauma, means just before this the complaint the patient came with, is there any trauma or accident that happened to him that might have led to this? You have to ask everything in detail. For example, um about the surgical history, you can ask for C-section. If the person has underwent a C-section, came with the chief complaint of swelling over the lower abdomen, it can mean it might be a hernia. It might be because of the C-section that is improperly done. It can even lead to herniation. The other example for history of trauma, importance of history of trauma here is in case of actinomycosis or Madura mycosis, Madura foot, you are going to ask about the history of uh, trauma with a thorn prick, if there is any thorn prick that happened to him, like that. So because the thornprick will can inject a fungus into the body of the patient, which can lead eventually to madura mycosis. Whereas actinomycosis, the case is dental surgeries. If there is any dental surgery that he has underwent, then the dental surgery wound, if it is what can we say, loosened or improper, then it can allow normal flora present in our mouth, actinomycosis bacteria, that can actinomyces bacteria actually can enter the wound to colonize the site to cause actinomycosis. Okay, next coming to the drug history. So we are in the past history. We completed about similar complaint in the past, comorbidities, previous illnesses, surgical history, and traumatic history. Now coming to the drug history. If is on any medications like long-term medications like diabetes mellitus, hypertension medication, tuberculosis, antiretroviral therapies, anti-tubercular therapies, all of this, leprosy maybe, all of these things. If he is on any medications, you have to ask about it. If he has any cancer, he will be under chemotherapy. If he has any autoimmune disease, he might be on any steroids. So you have to ask about all of this, because the treatment will also depend on the previous drug history, because there can be a drug interaction when the patient is getting treated. So that is the thing that is very important here. Then about the history of allergies, if he has had any allergies for medications or food as well, because few medications the doctor cannot prescribe in case of any bacterial infections. If the doctor has to prescribe for penicillin, he cannot prescribe until and unless the patient has no allergy for penicillin. Few patients have developed allergy for penicillin, so penicillin hypersensitivity, so he cannot give it. So to rule out that, the patient should be asked about history of allergies, he had any allergies. Then coming to the history of immunization, if he has underwent all the has taken all the vaccines or not, he might be knowing few things. If there is a mark on his left deltoid muscle area, that is BCG vaccine, then it probably means that Anganwadi worker or PHC worker might have already given all the doses of vaccines. It's important, but not that much significant. So you can include this or not include this in few other cases. So next coming to the family history. In family history, you are going to ask about any disorders or diseases that are run in family, like hemophilia, tuberculosis, diabetes, hypertension, peptic ulcers, cancer, breast cancer, fissura in ano, anorectal fistula. Basically, it is piles and hemorrhoids, varicose veins. Varicose veins are seen in mothers. Their daughters are most common, most, what can we say for that? Will can get that varicose veins easily. There will be a predisposition of genetic factors as well, so that will make it easy. So you have to ask for that. And parents history, siblings history, any similar complaint the patient came with, if the family members have it or not, you have to ask about it. Then coming to the personal history, we have completed demographic details of the patient, chief complaints the patient came with, history of present illness that the patient has come with, and past history we have completed, family history we have completed. The last part left in the history taking in approach of a patient to in the surgical outpatient department is personal history. Personal history is very common in all the many other branches like departments as well. Here let's discuss about it. Diet diet, if you have to ask if the patient is vegetarian or non-vegetarian. And coming to the appetite, if you have to ask for if it is normal, increased or decreased. Like appetite may be increased in case of diabetes mellitus, polyphagia, polydipsia, polyuria, right? So like that. And sleep, if it is adequate or inadequate. Because of pain, few people cannot sleep, like that. And bowel and bladder, movements, like if it is regular or not, and if there is any burning maturation present, you have to ask for it. And coming to the marital status, if it is married, if he is married, and he or she is married, and you have to also ask for if the marriage is consanguineous or not. Consanguineous means the marriage between two people who are closely related, so that is called consanguinity. In those cases there will be few disorders that they might pass down to their children. Not passed down exactly, because of their marriage their children might be having a high chance of getting any uh, abnormalities in the body, mental retardation. Most commonly you can see absence of upper limb digits in few people, absence of joints, especially few small phalangeal joints or joints in the toes. You can see the absence of them in marriages, kids of couple whose marriage is consanguineous. So you have to ask for history of consanguinity in their parents, and if he or she is married or not. And coming to the addictions, this is very important in case of few swellings or carcinomas, cancers, tumors, because alcohol, smoking, tobacco, all of these will cause one or the other carcinoma or cancer in the body. So you have to ask for it. About this, I have detailedly discussed in the general medicine case scenarios. Check it out. And alcohol is you have to uh, uh, units of alcohol that a patient takes. You have to measure it, you have to calculate how many units that he is taking. Different types of alcohol will have different units, and not required exactly, uh, maximum that he can drink, to avoid health issues like that. And smoking, you have to calculate in units of pack years, you have to calculate like that. And tobacco, this gutka, pan, whatever is taking, you have to he or she is taking, you have to ask for all of that. Then, if the patient is a female, you even have to ask for menstrual history. In if it is related, like in case of any pelvic swellings and all, you have to ask for menstrual history, obstetric history as well. Not in detail, but you have to know a little about it. Like history, you have to ask about if the menstruation is regular or not. If she is having any dysmenorrhea, that is painful menstruation, if there are any pregnancies or miscarriages that she had, if there is any C-section that she has got done. C-section here again is important in case of hernias. Now coming to the vaginal discharge, if there is any vaginal discharge, like that. So till here, that completes our general scheme of history taking in case of a patient coming to the surgical outpatient department. So that is it for this video. In the next video, we'll be talking about physical examination, how to do a physical examination in a patient who has come to the surgical outpatient department. In that, we are going to discuss about the general survey, local examination, general examination as well, and then a systemic head to toe examination as well. And then we'll go and then in further videos we are going to discuss about different case scenarios, like if there is any case of swelling, ulcer, how you have to take history, how you have to do general examination, local examination of those. uh, it can be hydrocele cases, parotid swellings, neck swellings, abdominal complaints, any lower limb complaints, upper limb complaints, head and neck complaints, whatever it is, we will discuss everything in detail, video by video. Okay. So till here, we'll end this video. Thank you.